talking about some of the figures and some of this VARS data, so I'm going to just present on what actually we've got current up to date for the end of August, sales data wise, just to give you a reflection as to where we are. Again, it depends on how you measure these things, so we've got to take it with a pinch of salt to a certain extent, but we can look at trends, which is good. Just going to briefly look at vaccination rates as well, again from calculation of sales, but also looking at our Calfmatters survey. This day is not just about vaccination, it's about the whole of calf rearing. But as we'll see, BRD and antimicrobial use for BRD is a key area. So that this is certainly something that we can focus on. Then just show a bit of the data from the Calfmatters survey, and then finally some work hot off the press actually that will be presented next month at BCVA Congress from some work in the southwest. So yeah, I shall give you a bit more information on that when we get to it. So first off, really, I wanted to show this slide. So this is using Kinetic Data. So for those that are unaware, that's basically all the sales data that comes in from all the pharmaceutical manufacturers. And what we've done here is filtered by all antimicrobials used for BRD. So this list was compiled using the VMD and the NOAA compendium. As Elizabeth has alluded to, some of these antimicrobials can be used for other things. So, you know, long-acting Oxytec could well be used for lameness. So it isn't specific just for pneumonia, but it is all those products licensed for it. And hopefully by showing over this time frame, we can see a trend. So, you know, this is other diseases as well, but it gives us a good idea as to what trends are going on. I've actually requested from Kinetic why we have a leap from 2010 to 2011. What we've got here is a moving annual total. So the 2018 figure at the very end, 2017 to 2018, that is August 2017 to August 2018. So that gives us an idea, rather than using a calendar year where we'd only have sort of half a year for 2018, I've got whole year slots going back from now. So 2010 to 2011 seems to be quite a leap going to 2011, 2012. And you'll see that in some of the other slides as well. I don't think that's reflective of what's gone on in the field, but they're working on that and they'll let us know, so I'll let you know. But what we can see is that there's been a slight increase from 2011, 2012 to 2017, 2018 of around 3%. As Elizabeth has alluded to, this is not necessarily a reflection of increased use. This is because you may need more of one antibiotic if you're using less critically important antimicrobials, and we'll see that in a second. So what we've got here is volume, kilograms or litres of antimicrobials. So good news is from 2016, 2017, we've got a decrease of 1%. So that's hot off the press. So we're heading in the right direction. But really, the focus at the moment really is the high priorities. And as we can see here, we're doing really well. This is fantastic. So we've got a 41% reduction from 2011, 2012 to current day, which is fantastic. Obviously, red tractors played a big part in that. There's been a lot of talk of that this year. Vets, industry getting behind this, and people are really seeing, actually, I don't need to be using this, as has been led by many of the academic institutions. Bristol study mentioned earlier on as well. So that's really good to see, and that is again, other diseases, not just BRD. Those antimicrobials are your third and fourth generation cephalosporins and your fluoroquinolones. It's not including colistin because that's not licensed in cattle anyway. So just to give you a background to that. When we then look at that compared to vaccine usage, that's really nice to see as well. So again, ignoring that's a big leap there. From 2011 to 2012, again, we've got a really good growth of 47%. And we've actually got a good growth of 3% from last year and 12% from 2 years ago. Again, it's quite a blunt measure. We've got IBR in there. which some maybe wouldn't measure as a respiratory vaccine. We've not got BVD, so they are your injectable and your intranasal multi-component BRD vaccines, and your IBR in there as well. Okay, so that's showing a really good, we've got good trends with our HPCIAs and with our vaccines, which is good. There's still room for growth, however. This is data again from Kinetic, using data from BCMS, looking at actual numbers of calves. So if we're looking at 3.5 million calves, you can divide the number of doses of vaccine by the number of doses needed for a course. So for an intranasal, that's one dose is one animal. For injectable, it's going to be 2, your primary course. So again, you're going to have some animals that may have an intranasal followed by an injectable. So again, it's an estimation. But what we get is that we've got vaccination rates of around 13% for injectable multi-component BRD, not including IBR. Intranasal, we've got about 14%, and then we've got the rest, so plenty to go at. So we've got over 70% that are of animals are unvaccinated. If we then compare this to some of the data that we'll just touch on in a second, that from the Calfmatters survey, 65% of farmers said they weren't vaccinating for BRD. So they're roughly similar. You've obviously got survey bias, but that's quite nice to have a bit of a similar ballpark figure. Interestingly, Europe has quite a lot higher intranasal vaccination rate. I'm not sure why, but Europe on the whole is similar on the injectable vaccines front as proportion of all vaccines. Just going to show you a little bit of the data from the Calfmatters survey that was done this year. So this was done over August, so it's very hot off the press. Presented first at Dairy Day the other week. I won't take the credit. So one of our vets, Heather Nyman, brought all this data together and put the interesting weather-related information in there as well, which is, I think, adds another dimension to it. We had almost 400 respondents, and this was for the UK and Ireland as well. Was it representative? This shows the distribution of the respondents. So as you can see, we've got a pretty good representation from around the UK. In Ireland, those are you could only have basically a county represented, so we couldn't pinpoint exactly where they were from. But that's pretty nice representation of the whole of the UK. Mainly dairy, so it is a bit more dairy biased. Mainly male respondents, 29% female. How many calves did you treat for pneumonia on your farm in the last year? Just over half saying below 5%, which is great. We've got around a quarter saying 5 to 10%, and then some saying over 25%, some saying 10 to 25%. So on the whole, looking encouraging. For those where they were treating more cases, was it weather related? That age-old, well, the weather is something I can't control. And this is asking a few more specific questions about this. So the overall number of BRD cases on my farm was the same, worse, or better than normal. So that's encouraging. A quarter said actually it was better than normal. The majority saying the same. Mortality, again, the better, worse, or the same. The majority saying mortality was the same as last year, and less saying worse. The main reasons for those changes, the majority saying the weather being better or worse than usual. Some saying changes in stocking density or housing. So if we then look in a bit more detail at the weather with our friends from the Met Office, we can actually analyse in a bit more detail, actually, was it a worse winter, was it a better winter? So if we start on the left, between September and the end of November, we've got the mean temperature for 2017, right? So for those months. And the red here is highlighting that it was slightly warmer than normal. So we've got our average here, running average from 1980 to 2000, I think. And it was generally slightly warmer autumn than it has been previously. When we look at the main winter period, December through to end of February, actually Scotland was slightly colder, but the rest of the country was about on average. Okay. What many of us remember is that dip there. End of February, beginning of March was pretty bad, and we can see that in the figures. But on the whole, for spring, so beginning of March through to May, generally warmer for the majority of England. Pretty much the same-ish, slightly warmer for Scotland. Okay, so just bear that in mind when we then look at rainfall. Slightly drier in the autumn months, so we've got a slightly warmer and drier autumn. For Scotland, it was actually slightly drier over the winter, so even though it was slightly colder, it was slightly drier, and it was slightly wetter in certainly the east of England. And then looking at the spring, we can see a lot wetter in England. I feel like I'm on the Weather Channel. A lot wetter here in England and drier in Scotland. So just something to bear in mind. You remember that end of February, but actually on the whole, it wasn't necessarily as bad perhaps as we thought it was. So when farmers are asked what was the biggest impact of calf pneumonia on their farm business, actually very similar responses this year to last year. We've got the same categories in the same areas. We can see the increased vet and medicine costs. Again, is that perception? Because the studies would show that actually that is not the biggest impact of disease. Loss of income from less productive calves, so that's good to see that's that's a high figure, especially considering it was the same pattern as last year. And then loss of income from dead or culled calves, again similar, so third place to last year. Which of the following management methods do you currently implement against calf pneumonia? Again with the 2017 figures in there as well. So we've got colostrum intake being something that people are saying, they're making sure that that's in within 4 hours. Calves housed in similar groups and optimal housing conditions. So those messages are getting through. We don't know whether they're actually being done, but they're certainly being reported. Something that's always been of interest really to a lot of the meetings we do is the calf jacket penetration rate is a lot higher than the calf vaccination penetration rate. And again, that would be very similar to last year. So we're all in the wrong business. We should be selling calf jackets. And I think it's just that seeing a calf with a jacket on, it's just so much more, people, they grab hold of that, whereas a vaccine, if you can have a line extension with some sort of halo around that calf, it would work wonders. So they're certainly taking off, they're doing really well. That calf vaccination rate, again, as I've said previously, around 13-14% for injectable vaccine, so that actually fits quite closely with what's happening from sales figures as well. Regarding vaccination, please indicate whether you vaccinate or vaccinate all calves, only those under 3 months, only under 9 months, or all animals brought onto the farm. So again, about 2/3 saying they don't vaccinate. Broadly similar to what we're seeing in the market. If you have vaccinated calves in the past 3 years, please indicate whether you have observed differences compared to unvaccinated calves. And this is a nice message that actually people are seeing that, yes, that they're seeing a benefit from vaccination. A lot of the time it's a leap of faith. You're spending money up front on something that you may not see the benefit from, especially if it's to guard against something that might happen. It's an insurance policy. So we're seeing reduced incidence of calf pneumonia, improved calf health and well-being, and critically really for us here, reduction in use of antibiotics. Again, similar pattern to last year, so that's encouraging. So if we can get people actually using vaccine, we will see that they perceive that to do a good job. If you have not vaccinated or have stopped vaccinating calves against calf pneumonia in the past 3 years, please indicate your reasons. So the headlines ones really, no incidence of calf pneumonia on the farm. So is that subclinical that they're just not seeing? You know, are they just not measuring for the impact of calf pneumonia? Upfront cost of vaccination, we all know, you know, paying upfront for the long-term benefit is always a tricky one to get your head around. Unsure of the benefits of vaccination, again, similar. The vet has not suggested it, or treating individual cases is cheaper than vaccinating. So I think we're changing that, and as we continue with the survey, we'll hopefully see a change in that spectrum. Winter is coming. So you've got a nice slide here with most of the calf jackets on. So this question was asking farmers what they're going to be doing for the coming winter. And what we can see, again, housing is going to be a key focus. Colostrum, similar to what people were saying they are already doing. And again, it's boding well for the calf jacket market. That's where you should put your money. So that's excellent. What proportion of your calves have shown evidence of calf scour in the past year, and which of the following do you use to treat cases of calf scour on the farm? So we're focused more on BRD, but certainly scour is an area of focus as well. So the majority seeing below 5% calf scour, which is good. What are they doing to treat cases? Oral rehydration fluids, obviously, as we'd expect. Some still restricting milk. Hopefully that is something that's changing. We've got some using injectable and antibiotic in some cases, by far the majority versus those using in every case, and that's what we want to be seeing, and that's good. And non-steroidals as well, and there is evidence behind using pain relief to actually get calves over calf scour as well. My last slide is just on some work from actually one of our delegates' colleagues, and this was presented recently, some master's data, a master's in international animal health from Alistair Moffitt, based at Synergy Farm Health in the southwest. And it was based on some work from the past 5 years, looking at a slightly different measure of antimicrobial usage on a good number of farms, looking at a cow calculated course derived over a 5-year period. Okay, so I won't go into the details of how that's sort of measured, but it's basically looking at a treatment course using the NOAA prescribed or the SPC prescribed course of an antibiotic, looking at cows defined as animals over 24 months, young stock less than 24 months, and looking at that trend over 5 years basically. What Alistair and colleagues showed was that actually there was a 31.5% reduction in adult cow calculated courses from 2012 to 2017, and the median in 2017 was 1.16 courses per cow, so certainly heading in the right direction there. And in young stock there was also a 3.5% reduction, a median of 0.62 courses per calf. For that young stock group, the minimum was 0.01 courses per calf, but the maximum was 4.67. So there's quite a range in there. Generally, looking at HPCIAs across cow and calf, there was an 80% reduction, which is fantastic. Again, that's mirroring what we're seeing on the national data. And the summary was that categorising antimicrobials as used only in young stock can be tricky with regards to defining young stock numbers, defining antibiotics only used for young stock, as we've seen with the sales data. And beef animals on dairy farms can complicate dairy figures as well. There appear to be less quick wins, so we're seeing quite a difference really in the wins between cow and calf. So there appear to be less quick wins with young stock compared to adult cows, and we can think about strategic dry cow therapy as being as an easy win on the adult cow market, whereas in calves, most people are using antibiotics where they're needed rather than as a blanket course, which is what we're hoping anyway. So it's going to be using more prevention, housing, management and monitoring changes, to be ahead of the game, and this is where vaccination can play a key part for the long-term reduction rather than the quick wins. So that's it from me. Just thanks to Heather Nyman for pulling together all that Calfmatters survey data. We'll be talking a bit more about that over the next few months. And thanks very much for Alistair for sharing his data that's hot off the press. It is being presented at BCVA next month. So thanks very much to Synergy.